Hi, and thank you for joining me today as we continue our video series on CRPS. I'm Dr. Traci Patterson with Holistic Center Treatment, and on our last video, we started talking about neuroplasticity. So now I want to transition to the next step, which is talking about the autonomic system. So let's jump in. Because the more that we understand about the body, the more we understand the pieces of CRPS and how they interconnect, then we're better equipped to help patients move forward to reach your goals. So basically, it's getting back to the biology and the physiology of the human body and how everything plays together and how everything is interconnected. So let's jump in with, first of all, what is the autonomic nervous system and what does it do? So the autonomic nervous system is a division of the peripheral nervous system, and essentially it controls the things that we don't have to think about, what we call involuntary body functions, meaning the ones, again, that we don't consciously have to think about. So it regulates processes like our heart rate, our breathing, digestive, our pupils, our eyes dilating, blood pressure, even sweating. So these are different areas of the body that controls. So think of it again as the system that runs everything in the body that we don't have to consciously think about. And the autonomic system controls every function of every organ in our body too. So if we start thinking about the longer CRPS goes on, people start talking about my eyesight's getting worse, I'm having digestive issues, I'm having acid reflux, I'm having bladder issues, I am having heart palpitations, but yet we go to the doctor and they say everything is perfectly fine, but we know it's not. So the autonomic system has two main branches that we look at. One is the sympathetic nervous system, and that is tied into fight or flight. And that prepares the body for stress, for dangers, for emergency situations by increasing our heart rate, dilating our pupils, slowing down the digestive, because it's sending information out to our extremities to get out of the way of danger. And the parasympathetic, also known as rest and digest. And that's responsible for the functions tying into that. It helps the body relax after stress, slowing down our heart rate, and even promoting digestion and even energy storage. So that's the difference between the two. But then there's also a lesser known third part called the intrinsic nervous system, which specifically governs the function of the GI tract. So if we think about that as a subdivision of the autonomic system, it directly controls the gastrointestinal system. And it's embedded in the lining of the gastrointestinal system, and it can operate independently of the brain and even the spinal cord. So when we start talking about a lot of people with CRPS that have digestive issues, gastroparesis, that is a piece that definitely ties into that can start connecting these pieces for you. So hopefully that makes a little bit of sense as you can start seeing the different ties in there. So let's jump into the sympathetic nervous system, because fight or flight is what we're always hearing about in regards to CRPS. And when we think about getting stuck into fight or flight, or that sympathetic overload, also a sympathetic nervous system activation, it can have serious effects on us physically and even mentally when we start looking at our health. And that happens due to prolonged stress, pain, anxiety, even trauma. So that's where these pieces start coming together. And with CRPS, we're always hearing a couple of different phrases. One is fight or flight, and then the other one is sympathetic overload. And it's the driver of the mechanism to CRPS is fight or flight. So when we understand that, then that's going to help us move forward. But when our body is stuck in fight or flight, it affects so many different areas and aspects of the body. Physically, it can elevate our heart rate, our blood pressure. It can cause changes in our breathing, digestive issues, muscle tension, poor sleep, a weakened immune system, even hormonal imbalances. And then if we look at the mental and emotional effects, it can cause anxiety, panic attacks, irritability, mood swings, difficulty concentrating, brain fog, emotional overreaction, again, because we're in fight or flight, and even an increased risk of depression, or for some people, even PTSD, as it all culminates together. So when we think about a CRPS patient and what we live with on a daily basis, it's not just the pain. It's pain, it's stress, it's anxiety. For some people, depression. For the majority of people, insomnia. And it creates this loop because pain causes stress and anxiety. Stress and anxiety then increase our pain because it's tied together. And stress, anxiety, and increased pain also causes insomnia, also known as painsomnia for people dealing with CRPS. And that's just part of what people deal with when we're dealing with CRPS. So the first step to really effectively treating or working with CRPS is addressing fight or flight, or balancing the autonomic system. And when we can get the body out of fight or flight and calm down that sympathetic overload, starting to balance the parasympathetic and the sympathetic, that alone starts decreasing our overall pain levels. So remember, knowledge is power. And with CRPS, we're always told this is the best it's going to get. You have to learn to live with your pain. You have to learn to function with it. We're told to give up on the dreams that we have, that life as we knew it has ended. I disagree with all of that, because when we fully understand the intricate pieces of CRPS and how it ties back to basic anatomy and physiology in the human body, that can help patients move forward, because then you can put the pieces together that are going to address all of you as a whole, physically, mentally, even emotionally. So I hope you found the information helpful on the autonomic system. For more information on CRPS or effective treatments that are non-invasive and drug-free that treat you as a whole, please reach out to us at Holistic Center Treatment, www.holisticcentertreatment.com, or 844-994-0999. And I look forward to seeing you next time. Thank you.